Hi, and welcome to another episode of SMECO Connects. I am Tom Dennison. I am filling in for our President and CEO, Sonja Cox, who is unable to be here today. But I am honored to be here with Dr. Menna Brewster, who is our health officer of St. Mary's County, and someone who has a very important job in our community. And I think from our perspective at the SMECO Connects podcast, we like to not only just talk about SMECO related things, we also like to talk about things in the community and what's happening in the community. And there's obviously nothing more important than the health of our community. And we have someone here who's on the front lines of that effort. And so, Dr. Menna Brewster, thank you for being here. And if you could, just introduce yourself and how long you've been in your role, and we'll take her from there.
Thank you. Thank you so much for having me. I really appreciate the invitation and really appreciate how SMECO is tuning in to important issues throughout our entire Southern Maryland region. Thank you for that.
Our pleasure.
Yeah. So I've been in my role as a local health officer for St. Mary's County for a little over 13 years now, heading up on 14 years. And it's just been an incredible, incredible journey. It's been such an honor, really, to be so present in a community where people work so well together. And we just have a great team at the St. Mary's County Health Department who's very passionate and caring about our community members, and it's wonderful to work alongside them.
Yeah, and I think just so our audience understands, there's so many things that go on at the health department. Everything from, we were talking before the taping, just about outdoor permit requirements that are needed for events, to the water testing, to environmental related things, and then, oh, by the way, the health of our community. So if you could, Dr. Brewster, just explain some of the core things that are going on at the health department, kind of what you would like to share with our audience.
Sure, thanks. That's a great observation. Local health departments, our vision is about what can we do to improve the health and wellness of our whole community. And there's different parts of a community that impact the health and wellness of the whole community. One, it's individual health. So what can we do to support individuals in making healthy decisions and dealing with all the potential risk factors for poor health later on in life, and focus on prevention so that they're building up a lot of the protective factors of health in their life. But it's also about dealing with systems and the environment and what we build in our community that help people be healthy. So while we do hope that individuals make the healthier decisions for themselves and their families, we also know that communities need to give them systems and the environment to support them in that decision making, and to hopefully make it easier for the whole community to be functioning at its optimal health.
Yeah, and so the biggest part of your job, I would think, would be making sure all of those programs sort of mesh together. Can you describe a little bit about what makes that process work in St. Mary's County?
Yeah, a lot of teamwork. Definitely a lot of teamwork. Public health is one of those fields that we call, that we say we can't do anything without partnerships. And that's true every single day of the way I've practiced, the way I've seen public health practice. We really work across sectors with a variety of partners in both the public and private areas to find ways that we can leverage resources, that we can all have a shared plan of improving health for the county. And we do things together. We roll out initiatives and programs and services together as a community. We get health information out to our community members together. And we find ways to bring our own expertise to the table so that we get a kind of a full scope picture of the issue and affecting communities in different ways.
Yeah, so if you're a resident of St. Mary's County and you may be, say, elderly or a young person, you can go to the health department if you have certain questions or even ailments, right? You can point them in the right direction. Is that correct?
Yeah, absolutely. And that's a really good, how do people intersect with the health department?
Right.
And there's many different ways. And you mentioned some earlier when you brought up some of the things that we do in the environmental health realm, things with permits and food safety and so forth. And that's because the environment has an influence on the ways, on people's health and the ways that community can support health. And so we do work in the environmental area that's related to health because of that, things related to wastewater and food safety and rabies exposure and those types of things. But then there are other portions of our health department, and people intersect with those in different ways. And so the one you're mentioning now is if I need services, and maybe you're looking for healthcare services, or you're looking for health information, or you're looking for the supportive programs that will help you have health in your life, even if it's not like kind of the direct clinical services that we typically see in doctors' offices. So the health department does a lot of that work. And if we don't do it, we help get people connected to where it's happening in our county. And we look at what kind of barriers people experience to accessing health services and that's where we work with our partners to try to find solutions to that. So if transportation is a barrier in St. Mary's County for people getting to their health and wellness type appointments, what can we do with our partners to try to overcome that barrier and other such barriers that we may see? So access to care and the prevention supporting access to care, I would say, is a pretty top health priority for us as a health department, and then also a top priority, I know, for our community members in St. Mary's County.
Absolutely. And I think if you were to describe the biggest kind of challenge in St. Mary's County from a health, not only just as the health department, but kind of across the community, what are you kind of seeing, and how has that maybe changed from when you started 13 years ago, or is it pretty much the same?
Yeah, I mean, a lot of the when I started 13 years ago, I know community members in St. Mary's County are very concerned about access to care and access to healthcare services, and that concern has persisted. It looks a little different now than it did 13 years ago, certainly, but that certainly is a major topic of priority for our health department, as I mentioned. So I would say in that bucket, I would describe it as prevention and access to care, because a lot of times people may think, I just need to get to a doctor's office, but really what they're looking for are services and resources to help them prevent illness in the first place, and to have that kind of long-term continuity of prevention and healthcare throughout their lifespan. So for the young people and then the older people and everybody in between, who are looking for optimizing their health and focusing on prevention. So that I would say is one bucket, and there's a lot that goes underneath that. I'm happy to talk about that more.
Yes, please do.
Maybe I'll mention a couple others first, and we can go back to access to care. The other two topics that I've heard quite a bit about from our community members, and I can reflect upon as well from my experience in our county in St. Mary's, is the second is really the focus on behavioral health. Okay. And when we say behavioral health, when I say behavioral health, I'm including mental health and also drug use prevention and treatment and recovery supports for substance use. And so that together is what I'm describing as behavioral health. And the third bucket, I would say, as that's a health priority really that stood out from my experience as health officer in St. Mary's County, is that we want to make sure we have strong systems in place in a community. And that's not just healthcare delivery systems, that's across sectors. We want strong systems in place in a community so that we can be ready to protect our community and our community members when there are emerging threats to that community. And for us in public health, we're really concerned about, of course, emerging health conditions or illnesses or infections, as well as public health emergencies that might come up, where we need to respond really quickly and get people the information they need and get them access to the services that they need, and do so in a very coordinated and clear way.
And I hate to bring up the COVID situation that happened a number of years ago, but that to me, that effort from a public health standpoint was amazing to me to kind of watch. I mean, I'm on the board of the Charles Regional Medical Center in La Plata, and the work that was done in coordination with the health department in Charles County, I know was very similar to that in St. Mary's, and I know your work was highlighted across the state in various newspapers, other mediums that I read, that the way you all handled it. So kind of looking back on that, Dr. Brewster, what did you learn from that pandemic, and kind of how do you take those lessons and apply it going forward?
Yeah, that's a that's a really great question, and something I definitely love to talk about. So I'll keep it short.
Oh no, please.
It was an all-consuming effort, as you all know. I mean, not just for us who work in health care or in public health, but also for our community members. I mean, there are so many elements to this pandemic that challenged us as a community as a whole. The biggest piece for us, the biggest lesson I learned, at least from my role as a St. Mary's County health officer, is that we have to have strong partnerships every day and be nurturing those strong partnerships every day, because those strong partnerships are what allow us to respond in a coordinated and effective way for our community members. And that's what happened with our COVID pandemic response in St. Mary's County. And I like to think that, maybe being at the tip of the state, we tend to figure out how to get things done on our own sometimes, and we tend to figure out what resources we have locally, and we work together. I mean, we communicate all the time, and we have to figure out how to do so in a strong way for our community. And so that was the picture of COVID response for St. Mary's County. We had all these amazing partners come together, volunteer their effort, volunteer their time, really figure out a way to leverage resources across the community so that we can do things like a mass vaccination site. We can do things like having testing sites across the county. We can make information available to our community and make sure we have treatment available throughout the county as well. So there was a lot of elements of that response. We definitely learned a lot. And hopefully, we're in the process now, both locally and then also at the state level, of applying many of those lessons so that we're better and we're stronger and we work more effectively together for the next whatever issue might arise.
Well, credit to you and the work that you and your staff did, and all the difficult things that had to be done back then. So when you talked about partnerships, I think I would imagine a major partnership for the health department is with our schools. Mm-hmm. Can you kind of talk about some programs that the health department has with our schools and why they're important?
Yeah, absolutely. And that so maybe I can bridge into that first bucket I mentioned, which
Absolutely.
was prevention and access to care. So for us as a health department, our approach is looking at the whole community and looking at systems within that community, including the healthcare delivery system, and finding what gaps might be there, what populations may not be able to access the services they're trying to get access to, and ways that we might be able to do things a little bit more efficiently with less strain on the systems that we have, the economy, workplaces, et cetera, and schools. And so within access, that bucket of prevention and access to care, we wanted to have a way for students and staff in schools be able to stay in those environments but still get their healthcare needs addressed.
Excellent.
And we didn't want the parents of the students to have to leave work to come get their kid and to go sit in an urgent care for several hours and to figure out what's going on and to get healthcare help for their kid. And so that has a big impact on workforce and the economy, right? When parents have to leave for that reason. And so through a partnership with the St. Mary's County Public Schools, and actually it was a partnership at the time that we had with the St. Mary's County Sheriff's Office as well, we launched 2 school-based health centers in St. Mary's County. These were the first school-based health centers in Southern Maryland. I know more recently, there's one that's opened up in Charles County as well. and we help them along with some information to help them establish that. And the idea of the school-based health centers is that and for the way we operate in St. Mary's County, the students and staff of the public school system at any school, it doesn't have to just be the 2 host schools for those school-based health centers. So students and staff from any public school in St. Mary's County can come to those school-based health centers during school hours. And then after school dismissal, those school-based health centers are open to the entire community. You do not have to be associated with the public health or public school system for that. And what that means is that for students, especially those at the host schools, and for us, our host schools are the Spring Ridge Middle School and Margaret Brent Middle School. So we've got a point in the southern portion of the county and kind of north central portion of the county. And for us, it was really important for those students and staff members at those schools. They can just head over to the school-based health center, which is on their school campus. They get seen. It's like a regular primary care office. We do testing that gives rapid results for all kinds of respiratory infections and other illnesses. We have a clinician who can evaluate them fully, get them treatment. That clinician or a primary care clinician will reach out to their primary care doctor in the community and coordinate care. That clinician will reach out to the parent. If it's a student, they'll reach out to the parent who's not on site and is able to stay at work and reach out to the parent and make sure they're involved and they know what's going on. And in fact, usually the school nurses will call the parent before they send them over to the school-based health center anyways. And we can do all of that while the parent is able to stay at work. And if we determine that it's safe for a student or staff to go back to the classroom, they do. And that it's a very short amount of time then that gets lost. And in fact, our numbers have been at about 80 to 85% of students after being seen at the school-based health center go back to their classroom.
That's such a great service. And how long has that been in place?
Yeah, we've had that for a few years now.
Okay.
It's taken a little while to establish and get the word out. And families and community members, again, you don't have to be associated with the public school system. You can actually auto-enroll into the program. And so if you have a kid, and so, when we launched, my daughter at the time was going to Spring Ridge Middle School. And so I would enroll her in the school-based health center system. And then if she had a health issue, she could walk to the Spring Ridge Middle School school-based health center and be seen and evaluated because I've already given that consent and enrolled her. And of course, they're contacting me and letting me know and speaking with me throughout. And then I can either pick her up if she's not able to go back to class. Meanwhile, I've been able to stay at work that whole time. Wow. Or she goes back to class and she comes home like she would normally come home.
I mean, having 2 daughters of my own who went through Charles County Public Schools, and there was a lot of time where if they were sick or whatever, you just, you got to go and pick them up. And having that level of service is great. And I would imagine it's great for like athletic physicals.
Absolutely. We do sports physicals.
Sports physicals and, heaven forbid the strep throat issues that go around and flu and everything. It's got to be a service that you've really probably gotten a lot of thanks for. From parents, I would assume.
Well, I hope parents know about it. I hope they're making use of it because it really is a great resource, and it's a wonderful way to keep your kids in school if they are able to stay in school, and then for you to be able to stay at work or handle the other responsibilities you might have while your kid's getting taken care of. That's
great, and I don't know if this is the case, but the school nurses, I believe, are health department employees.
In Charles County, they are.
In Charles County.
In St. Mary's County, they're not. In St. Mary's County, they're with the school system and the Board of Ed. It used to be with the health department, and then over many years, pieces of it trantioned over to the school board.
I never realized that, but I had a neighbor who was a school nurse in Charles County who worked for the health department. So in light of the tremendous number of programs and things that are happening at the health department, Dr. Brewster, what is the biggest challenge you see coming up in the next whether it's the next 5 years, the next 10 years, or maybe even just in the next 12 months that you kind of see on the horizon?
Yeah, well, I'll definitely go back to those three kind of health priorities that I mentioned before, because I think they will persist in being the greatest challenges we'll have in the next decade in health and public health. And in particular, I talked about for access to care, I talked about it's important as a community to ensure that we have different kinds of clinical services, especially primary care and oral health and behavioral health clinical services in our community. And of course, health departments and others step in and they help fill in the gaps. But it's also really important for us to have a connected community supporting that healthcare delivery system and to have the workforce pipeline that we really need to maintain that healthcare delivery system. And so on that, the connection piece, what I mean there is that, and this is where a lot of health departments do work and a lot of community-based organizations do a lot of good work, is they focus on prevention and they focus on the things that tend to be outside of doctors' offices, on wellness, on addressing risk factors for illness and improving protective factors for good health. And so they do programs and services, and they get out there in the community, on the in the streets and communities and homes, and they really work with families and try to give them a better chance of optimal health. And so we have a lot of programs and services throughout the health department. Many of our community-based partners have programs and services like that. It's going to be really important that all of this is connected well, and that we're coordinating across all that we get, that our community members are able to access all of those things, not just the doctor's office. And so that's where it's really important for that communication and partnership to be happening at local levels. And that's what your local health departments do. Local health departments are what we describe as chief health strategists for their communities. And so they're the ones that tend to convene partners together around health issues and to really, again, leverage resources across sectors to get things in place. And then the other piece, too, that I think is really important with access is that workforce pipeline. And what are counties and communities across the country really doing to create that pipeline and to recruit from their own and grow their own, really, workforce pipeline. I think that's going to be, we already know that that's at a crisis issue across the country, especially in things like primary care and behavioral health.
I was just going to say, I would think that not only at the health department, but I think all hospitals, I think they're looking for nurses and certainly primary care doctors and things. So that's also a challenge that you have. And I mean, SMECO faces workforce challenges with hiring engineers and hiring linemen to do the work that we need to have done. So it's certainly workforce is always going to be an issue.
Absolutely. I mean, it's essential community infrastructure. Health and public health is essential community infrastructure. And so that's where we as leaders and members of community really need to work together and make sure we're keeping that going for future generations.
Excellent. So kind of wrapping up here, was there anything that you'd like to highlight that's going on at the department that I didn't ask about? And then finally, if someone is interested in finding out more information about the department, how would you recommend they do that?
Oh, great. Thank you. Maybe a couple things.
Yes,
I think let me talk a little bit about behavioral health, because I know that's ever present on everyone's mind, especially I know a lot of parents out there like me who are concerned about our kids and our families and just mental health in general. So I think it's, the work, and not just our health department, I mean, every health department across the state, but part of the work of that chief health strategist role that health departments have is to look at their behavioral health systems of care in their jurisdictions and to identify where there may be more services needed. And again, to work with partners to try to get those gaps filled. And so part of what we've been doing in St. Mary's County is building a continuum of behavioral health crisis care. And so there's different ways. So when somebody's in a bad spot in their life and they really just need an extra hand and some help and maybe even somebody to coach them on where to go, right? Or maybe they're concerned about their kid or their loved one or themselves, and they just don't know where to go and what to do. There are resources available, and we are working more and more to get those resources to be stronger and to get more resources available. So people need a place to call, people need someone to respond, and people need a place to go. And so for a place to call, there is 988, and that is the National Crisis Hotline. And I would recommend, even if you're not sure if what you need meets that requirement for a 988 phone call, or even if you're not sure if what your concern is it a mental health concern, is it a drug use concern, I'm not really sure, you can still call that number and get help on the other side. Somebody will help you on the other side. We've also in St. Mary's County have deployed, in partnership with Charles County actually, deployed some behavioral health mobile crisis services. And we're working with other partners to try to expand those access points across the entire Southern Maryland region. And so that's someone to respond. Can somebody go out to somebody or a family in need or in crisis and really work through with them in a space that's comfortable for them on those mental health or drug, substance use types of concerns that may be there? And then the third is a place to go. And that's where a person or a family or a community member can go to a place and get the help they need in that moment and not have to wait for 6 months on somebody's waiting list because there's just not enough healthcare providers in our community. And so that's what we've done in St. Mary's County. That's what we've created with the St. Mary's County Health Hub. That's a facility that's on Great Mills Road. It is open for walk-in services. And right now it's open during business hours, Monday through Friday. But we'd love, if there's support in the future, we'd love to be able to expand that into evenings and weekends. That's where anybody can come in, or they can bring a family member or someone they're concerned about, and just have a chance to talk with somebody and get some help, and allow a chance for them to express what their concerns are, and to maybe have an evaluation if that's what's indicated, and then get that treatment started if they need treatment, or get whatever connections to services done that they might need, and get connected to treatment in the community for the long term. So there's a lot of support we can offer through that.
It's a tremendous service, and I am so glad you talked about the 988 number. I don't know how many people know that service is available, and then the Health Hub is such a a great resource, I think, for people as well. So I'm glad you're able to talk about that, and then to just kind of summarize, is there any other program or contact information you'd like to provide to our listeners?
Great, and thank you for raising that again. I think it's really important that people have an opportunity to engage. So there are different ways to do that with local health departments in Southern Maryland. In St. Mary's County, of course, we have our general, St. Mary's County Health Department phone number, the 301-475-4330 number. Also our health department website, smchd.org. And then, of course, we have different social media platforms where people can follow what's going on. And for those who are healthcare providers or in the healthcare delivery system in our community, we also have a local health alert network where they can kind of, because of their particular role, they need to really be tuned into specific things, and where we share information with our healthcare delivery community. And for general members of the public who are interested in getting involved and making a difference in their community, maybe health is of interest to them in some way, but they're not really sure how to get involved and to help out. A great resource or a great opportunity to get involved, not just for individuals, but also for organizations, businesses too, is the Healthy St. Mary's Partnership. And the Healthy St. Mary's Partnership is our local health improvement coalition. And the health department supports it. Many other partners in our community are highly involved with it. And it basically, every 6 years, does an assessment of health of our entire county. We're in that process right now, and we're actually right now asking for community input into identifying what are the health priorities for St. Mary's County for the next 6 years. And once it looks and does that assessment of the county, it starts identifying what are the health priorities for St. Mary's County based on all that data and feedback we've gotten from our residents, and makes a plan of collective strategies that different organizations and people in the community can work together to implement. So,
wow, this has been a terrific podcast. I mean,
Thank you.
Dr. Brewster, you are, I think, a real credit to our podcast for you to come on and share so much information about what's going on, not only at the health department, but throughout St. Mary's County. And you're a real pro. Thank you very much for being here and sharing all this information. So thank you, and have a good rest of your day.
Thank you. Thank you so much. This is really lovely to be here. And I, again, so appreciate SMECO taking on this role in our community. Thank you.
No problem. Thank you.